Hi, my name is Sarah, and this is Molly, and we are going to be discussing the Motor-Free Visual Perception Test, 4th edition, otherwise known as the MVPT-4. So what is the MVPT-4? So it is a standardized assessment tool designed to evaluate visual perceptual skills. It has a motor-free design in that it doesn't require any motor skills. It really focuses on that visual perceptual aspect alone. It can be used across the lifespan, and it is administered individually.
So what does this test measure? The MVPT-4 assesses visual perceptual skills in 5 different areas. The first one being spatial relationships. This is the ability to perceive positions of objects in relation to oneself and to other objects. Then we have visual discrimination. This is the ability to discriminate dominant features of different objects. Visual memory is the ability to recognize previous represented stimulus item after a brief interval. And then figure ground is the ability to distinguish an object from a background or surrounding objects. And lastly, visual closure is the ability to perceive a whole figure when only fragments are presented.
So the MVPT-4 can be used, like I said, originally across the lifespan, but specifically at about age 4 and then into geriatric years, so 80 plus years old. It can be used in many different settings due to its limited materials. It can be used in schools, inpatient settings, outpatients, and it can be administered at home as well. Specific populations OTs may find it useful for is individuals that are demonstrating attention deficits, especially in the school setting, individuals with different motor impairments or motor coordination difficulties, and then actually older adults that may be demonstrating an increase in falls or increase in injuries.
So when you're assessing this, the examiner will sit across from the examinee with the booklet propped up as shown as in the image to the right. You want both the examiner and the examinee seated in an upright position with the booklet placed at a comfortable viewing distance away from the examinee at a midline viewing point. The examiner reads the exact instructions from the booklet when they're presenting a template to the examinee. So for example, it might say, look at this image, and you point to the top image and you say, now find it here, pointing to the bottom row. The examiner waits for a response from the examinee of either options A, B, C, or D, or they might say, I don't know. The examinee can either verbally respond or point to their answer choice. The examiner should wait about 20 seconds for a response, encourage the examinee to respond or state, I don't know, if the examinee is taking longer than that 20 to 25 seconds. And then this exam should should take only about 20 to 25 minutes to complete, and the parents do not need to be present if you are assessing it on a child.
So there are 45 total items on the test here, but these are some examples. So if we look in the top corner here, this shows that the examinee will be tasked with finding this image in the images below, which utilizes visual discrimination and figure ground skills. This image here with the ducks shows it tasks the examinee with needing to find the image that has been flipped over rather than just turned around, which requires them to use spatial relationship skills. This image here, the examinee is tasked with finding as many circles as they can in the image above here. And now the circles could be a different size. Again, this is related to figure ground. And then this last image here, the examinee is tasked with finding the image below that if you finish the lines, it would look like this image. So that's related to visual closure skills.
And then we do have an example video just to put it all into perspective.
So my wife got me this weird new tool for Christmas. And at first, I thought it looked kind of crazy.
Motor-free visual perception. Are you ready to begin? Look at this picture and now find the one exactly like it here. Here. Look at this picture Now find the one exactly like it here.
Listen.
So that just gives you a brief overview of what most of the questions will look like, but there are 45 of those.
Okay, and so when it comes to scoring the MVPT, an examiner is provided with a score sheet. The examiner will fill out the examinee's responses as they are going through all of the test items live. But the bolded letters on the scoring sheet determine or indicate which one is the actual correct response there. And so given that there are 45 total items, the examiner will then subtract the amount of incorrect responses from the total of 45, and then the examinee will receive a raw score. So you can see here, just a short example of one of the groupings here, you can see that this is where the examiner filled out the examinee's actual response, but then you can see the bolded letters such as here, which is the correct response. So once you go through and score it, you can see that this individual received a 34 out of 45. There's just one overall score. There are no subtest scores.
So this raw score can be used to determine various norm reference scores, such as standard scores, percentile rankings, age equivalency, and standard score confidence intervals. Interpreting these scores will involve comparing the individual's performance to the average performance of others in the same age group. Higher scores are going to reflect fewer deficits in general, various perceptual or visual perceptual functioning. The test is clustered into groups to give examiners an idea of examinees' relative strengths and weaknesses regarding different visual perception skills. However, the test results are only a snapshot of a person's performance at one particular point. It doesn't always give the whole story.
And so why would an occupational therapist use this assessment? Well, like we mentioned before, it allows them to specifically look at the visual perception skills and or challenges, which then allows for individualized intervention planning. So maybe they need to incorporate more visual perceptive aspects into their intervention to enhance occupational performance. Overall, this gives the examiner an idea if visual perceptual skills alone may be a main contributing factor to decreased performance in other areas of occupational performance or occupation, such as in the academic setting. And so it doesn't have that motor piece, so it allows you to pinpoint that one aspect. And so then these are our references, and thank you.
Thank you.